Left side chest pain is intriguing topic because everybody knows that heart located on left side, and when person feels pain, it causes fear of heart pain. Now let's uncover this topic and say what is the most common causes of left chest pain. Usually it's musculoskeletal chest pain, and it's not because of heart. And if person can point where his pain and where is tenderness, it's musculoskeletal chest pain, it's not heart. And this pain intensifies when you press. Palpation intensifies the pain, and pain is aggravated by movement in many cases, and it has short duration. This pain, musculoskeletal pain, usually lasts for several minutes, sometimes several hours, but it's usually correlated with short pain, and person can point with his finger where this pain is. It's musculoskeletal chest pain. Second most common cause of left chest pain is gastroesophageal reflux disease. Probability is 20%. Left chest pain is not specific for gastroesophageal reflux disease, but it usually causes more central heartburn and heartburn sensation, burning sensation behind the sternum. Here it's gastroesophageal reflux disease, and pain after eating and sensation of regurgitation. It means when person feels that food or acid back to mouth from stomach, is regurgitation and sour taste in the mouth in the morning usually. And this pain is aggravated when person lying down also. So it's gastroesophageal reflux disease. We focus on gastroesophageal reflux disease because it's very common condition, and it affects almost all ages, even young people. That's why it's important to consider gastroesophageal reflux disease. Another common cause is panic attacks. Probability of panic attacks is 15%. And characteristic and specific for panic attack is sudden onset. It has pain occurs suddenly, and feeling of impending doom, intense worry or fear. That's panic attack. And usually panic attack occurs without physical exertion. So if you're working out or if you go upstairs and you have chest pain, it's not panic attack. But if you're sitting calmly and you have sudden onset of chest pain, sudden onset of impending doom, intense worrying, it's many cases panic attack. It's not related with physical exertion, so it's not correlated with physical activity. It's important because if it's correlated with physical activity, it can be myocardial infarction or myocardial ischemia. That's very important difference between them. And panic attack chest pain is not relieved by rest. So if a person lying down, still pain continues because of panic attack. But if it's myocardial ischemia, in many cases pain will relieved by rest. Pain occurs during exertion and relieved by rest. It's myocardial ischemia. But if no physical exertion or no physical activity and sudden pain occurs, it's panic attack. Panic attack also characterized by shortness of breath. It's also important when person has no any lung infection or any respiratory problems and has shortness of breath with sudden onset of chest pain, it can be panic attack. And myocardial infarction or myocardial ischemia, very important. Crushing or heavy sensation is important. Person cannot indicate where this pain is because he feels crushing sensation or heavy sensation. It's very important characteristic, and usually it's correlated with physical activity. Person do some physical exertion and he has chest pain, especially among elderly people after 50, sometimes people after 40. After physical activity, heavy crush sensation is myocardial ischemia, and this pain radiates to jaw, left arm and back. If there is pain radiation, it's myocardial ischemia. So it's important because none of these other diseases have radiation. No radiation in case of musculoskeletal pain, no pain radiation in case of gastroesophageal reflux disease, no in panic attacks. But if there is pain radiation, it's myocardial ischemia. And how we can differentiate if it's myocardial ischemia or if it's myocardial infarction. Myocardial infarction is not relieved by rest. Myocardial ischemia or angina is relieved by rest, and myocardial infarction is not relieved by rest, and it's emergency condition, emergency situation, and emergency intervention is important and needed. And cold sweat also important characteristic. Of course it not always occurs, but also important to consider. And we should consider also pleurisy or pleuritis. Probability is 5%, sometimes much more lower because pleuritis is not common condition. And how can we spot that it's pleuritis? Pleuritis is outer lining of lung. You can see this small nice lining, and if we have inflammation of this lining, it's pleuritis or pleurisy. And characteristic is sharp stabbing pain one side of chest, and pain exacerbated by respiration, by movement, by exhalation, by inhalation, by coughing, by laughing. This chest pain is increased, and it's stabbing and severe pain actually. And person feels comfortable when immobilized. Immobilization gives this person relief. It's important also. And fever and malaise also common because usually it's because of infection, respiratory infections. But pleurisy in generally healthy people is rare. It's not very common. It's more common among kids. Even viral infection can cause pleurisy, but it's not very common among adults. And elderly also common when immune status is lower and impaired. So if we have left chest pain, first we think about musculoskeletal problems, second we think about gastroesophageal reflux disease, then we think about panic attacks, myocardial infarction, if there is reflux like pain radiation, like heaviness and crushing sensation, like not relieved by rest and not relieved by, and if it's triggered by physical exertion. And least we think about pleurisy if there is infection and if we have such stabbing pain in one side of chest. Thank you for your interest. Thank you for your watching. If you like my videos, please thumbs up. If you like my channel, please subscribe. Thank you very much. Bye for now.